But here is what we do understand, that a particularly good antibody test, there's many different kinds, but the ones that are most accurate and effective give you a clear indication of whether you have been infected by the coronavirus previously. And they give you some real confidence, because here's what we can say. Anyone who has been infected and came through obviously had the ability to beat this disease. Knowing if you've been exposed to it is powerful information. Our healthcare workers and our first responders who are dealing with folks who might be infected, it is going to give them additional confidence to know if they've been previously exposed. Think about what it takes every day to get up and say, I'm going to go where the COVID-19 is, where I know it is. The folks who go into the hospitals, the emergency rooms, the ICUs, the paramedics, the EMTs, all the folks who know they're going to where the danger is. They're, of course, thinking of their families, their own families, too. So having a sense of whether you've been exposed previously is very important. And giving the best answer we can brings a lot of value. On top of that, we are seeing really impressive results with treatments based on plasma that needs to come from those who have already been exposed. So there's a growing hope that when you identify people who have been exposed, you're identifying folks who can then give blood that then allows for the treatment of more people who are sick and help save lives. And we know one thing about our healthcare workers and our first responders. They are doing this work because they care so much about saving lives and helping other people. So knowing that they could be amongst those who give blood that saves other lives is entirely consistent with everything they've devoted their lives to. And then there's the fact that we're going to get information that can help us fight this disease. We all understand, the entire global medical community is still trying to understand the coronavirus, figure out the best ways to fight back. One day there will be a vaccine. One day there will be a cure. But the more information we gather, the more likelihood we get to that day sooner. So antibody testing brings a lot to the table. And our goal is to reach a lot of people who would like to take advantage of it on a voluntary basis, of course. But I'm talking about our healthcare workers. I'm talking about our police officers, our firefighters, EMTs, paramedics, correction officers, so many who would like to have this opportunity, and now it will be provided for all who want it. So, thinking about our healthcare workers, thinking about our first responders, we are initiating a plan to reach 150,000 of our heroes and give them this antibody testing, to give them that knowledge and that peace of mind, and to ensure that they are also helping us take the next step in fighting this disease. We have agreed to a partnership with the federal government, with the Department of Health and Human Services and the Centers for Disease Control. And more details will be announced in the next few days. But the plan is to begin as early as next week to offer the tests in hospitals, at firehouses, at police precincts, at correction facilities, wherever our healthcare workers and our first responders are, to make the tests readily available. Again, this will be provided for free. The federal government is covering the cost, and it will be provided to all who want to take advantage of this test. Now, I mentioned that I'm going to say the antibody test, no one is claiming it is perfect. It does not tell you, the best of I understand from all of our healthcare leadership and from listening to Dr. Fauci and others, it does not tell you if you're entirely immune in the sense we all think of that word. When we hear the word immune, we think you just can't possibly get something again. There is not yet confidence that having been exposed to the coronavirus once means you can never get it again. Now, common sense tells us if you're exposed once and you made it through, you're in very good stead. You're in a very good situation to make it through again if you ever were exposed again. But we don't know for sure if anyone can contract this disease a second time. The good news is, honestly, there's not a lot of evidence that people have, but we don't know for sure. So that's a limitation that we have to be clear about. And it's also important that even folks who get a positive result do not think that means that they can let down their guard. I'm not saying people would think they're invincible, but they have to be really clear that there still are dangers because we're dealing with an unknown disease. We're dealing with so many questions. So for healthcare workers and first responders, they would still continue in their work to wear the PPEs just as they were previously. And we still need to practice the same concepts, the social distancing, and we still have to be watchful for symptoms even if someone has tested positive. But again, it's not a perfect test, but it does give real information.